Let's close the book, return to reality, and give taxpayers the accountability they've long demanded. Because yes, their hard-earned money ended up paying for binge drinking monkeys in Oregon. What? So you're all saying, what? It is
just proved the COVID emergency never really ended for them. Years after the pandemic is over, the government is still sitting on $65 billion of your money. When Senator Joni Ernst tried to send it back to taxpayers, the Senate blocked it on the spot. Not debated, not amended, blocked. They say it's for the next emergency. But that excuse is exactly how temporary powers become permanent spending. Today, we're breaking down who stopped the refund, where the money is hiding, and why Washington never wants the crisis to end.
Mr. President, the COVID pandemic is over, and the emergency spending spree should be over too. The COVID-era Obamacare boosts were temporary, and now those temporary benefits are set to return to pre-COVID levels, exactly as the law intended. These emergency measures were for an actual emergency, not a forever program, and definitely not a backdoor expansion of Obamacare. Healthcare costs increased for everyone during the Biden years, not just those with Obamacare. We need a plan that brings down healthcare costs for everyone. In addition to ending the emergency spending spree, as the law says, we need to claw back every last COVID slush fund dollar before Washington finds a new way to waste it. There are billions of dollars still sitting in the U.S. Treasury with "for COVID" written on them. This summer, the GAO, the Government Accounting Office, identified $65 billion, that's billion with a B, still in COVID slush funds. Let's close the book, return to reality, and give taxpayers the accountability they've long demanded. Because yes, their hard-earned money ended up paying for binge drinking monkeys in Oregon. What? So you're all saying, what? It is unbelievable, but it's true. The Oregon Health and Science University raked in more than $1.8 million for this. In one study, monkeys were fed 8 to 16 alcoholic drinks a day to see how their chronic boozing affects COVID-19. Taxpayers didn't sign up for that, and it's long past time we put a stop to it. Let me also give you some examples of unspent COVID funds. $3 million is sitting in an account for museum and library services for COVID. $390 million for USAID's Emergency Connectivity Fund for Educational Connections and Devices. USAID is no more, so these millions should have been returned to taxpayers yesterday. $4 million for international broadcasting operations at the Millennium Challenge Corporation. And I challenge you to find any American on the street who would want their tax dollars going toward COVID funds for international broadcasting 6 years after the COVID pandemic. $389 million in COVID funds sits unspent for an HHS program management. and I think they've managed COVID enough. $1 million for USDA's marketing services. USDA. I can tell you that Iowa farmers would much prefer these funds be put toward a better use. $1 million for an account that just simply says science at the State Department. Okay, so let me tell you, my friend Secretary Rubio is holding down a lot of different jobs, but science? Let's give that COVID science money back to taxpayers. And those are just a few examples. I've tracked 82 program accounts. 82 program accounts with remaining COVID funding. My Returning Unspent COVID Funds Act is very simple. The COVID pandemic was 6 years ago. It's past time for the unspent COVID funds to be clawed back. Let's pass my bill and send these funds back to the Treasury. So, Mr. President, I ask unanimous consent that the Senate proceed to the immediate consideration of calendar number 266, S3166. I further ask that the bill be considered read a third time and passed, and that the motion to reconsider be considered made and laid upon the table.
Is there objection?
Reserving the right to object.
Senator Morgan.
Mr. President, I'm going to make just a few brief points in response to Senator Ernst's proposal. This bill would rescind each dollar of unspent funding from emergency supplementals, including funds America needs to prevent the spread of infectious diseases. For example, the Trump administration is using this funding right now, that's right now, to address an Ebola outbreak. Rescinding this funding makes America less safe. The point of the Rapid Response Fund is to have money in case there's a need for a rapid response. This funding can save lives. This bill would further rescind funding for medical supply chain development, manufacturing, and production to develop products like a universal flu vaccine to prevent the next pandemic. And it would rescind funding available to build a stronger healthcare workforce for nurses and diseases specialists who can address emergency interventions. I want to say to my colleague, we've always worked well together, that I'd be glad to work with her and other colleagues to have a comprehensive look at what should and shouldn't be rescinded because of the discussion we've just had. That's something that should be done as part of the appropriations process, not, in my view, through this legislation. For that reason, Mr. President, I object.
Objection is heard.
At the end of the day, this isn't complicated. Emergencies are supposed to be temporary. The COVID pandemic is over, but the spending mentality in Washington clearly is not. $65 billion in unspent COVID funds doesn't represent preparedness. It represents a system that refuses to close the books and be accountable to taxpayers. If Congress truly believes specific programs are still necessary, then they should make that case openly through the normal budgeting process. What they shouldn't be doing is hiding behind expired emergency authorities to keep massive slush funds available for waste, mismanagement, and political convenience. Senator Joni Ernst forced this issue into the open. Senator Ron Wyden's objection showed us exactly why reform is so hard. Once Washington gets comfortable spending your money, it never wants to give it back. And that's why trust in government keeps collapsing. This fight is bigger than COVID. It's about whether taxpayers ever get honesty, transparency, and limits on government power, or whether every crisis becomes permanent policy. If you want real accountability, real oversight, and real truth about how Washington handles your money, make sure you subscribe to Inside Washington Brief. Like this video, share it, and stay with us for more truth they won't show you.